Welcome to Florida Hospital Pepin Heart Institute. We were one of the first 50 hospitals in the United States selected to offer TAVR or Transcatheter Aortic Valve Replacement and the first center in the Hillsborough County area. The system we use at Florida Hospital Pepin Heart Institute for TAVR or Transcatheter Aortic Valve Replacement is the Edwards SAPIEN system. This is useful for patients who have severe aortic valve stenosis of their native valve, which leads to restricted output from the left ventricle and a variety of symptoms and other problems. The procedure can be performed either through the leg or through the apical portion of the heart, and we'll describe both of these. If it's done through the leg or transfemorally, usually a small incision is made in the groin, a sheath system is placed, and a guide wire is placed across the aortic valve. Following that, a balloon is introduced for aortic valvuloplasty, which follows that same guide wire. This is placed across the valve, the heart is rapidly paced, and the valve is dilated with this system. This serves to loosen up the calcific adhesions between the leaflets of the aortic valve and make implantation of the SAPIEN valve easier. Following aortic valvuloplasty, the RetroFlex system is introduced over this same guide wire. It's flexed as it crosses the aortic arch, and it is very carefully placed in position to avoid the coronary ostia and other structures using echo and cineangiographic guidance. When all the operators involved in the case are happy, the valve is dilated in place where it stays throughout the rest of the patient's life. So this is basically implantation of a stented valve, which is made of bovine pericardium, within the patient's own native valve. We've had 100% success with this route and very good clinical and angiographic results. Some patients cannot have the valve implanted through the femoral route because of narrowings in the femoral arteries or tortuosity. For this reason, the Ascendra system or the Transapical system was developed. This involves making a small incision in the chest wall, isolating the tip of the heart, and making a small apical incision in the left ventricle. Through that incision, a similar delivery system, which is the Ascendra system, can be placed directly into the left ventricular cavity. From that point, the procedure is very similar to the transfemoral procedure, only sort of in reverse. The guide wire is placed from the left ventricle into the descending aorta, followed by a balloon valvuloplasty balloon, very similar to the system that we showed you earlier. A valvuloplasty is done using the same procedural variables. That balloon is withdrawn, and then the delivery system for the SAPIEN valve is introduced through the apical sheath. Again, this is very carefully placed, avoiding the coronary ostia. It's dilated in place, the system is rapidly withdrawn, and the same checks with echo and angiographic guidance are done as with the transfemoral system. The sheath delivery system is then withdrawn, and the very small hole that was made in the apex of the left ventricle is sutured. The small thoracic incision is sutured. The patients are left with a chest tube temporarily and followed in the intensive care unit for a short period of time. We've had great success with both of these routes.